Hello everyone, in this video we are going to talk about physiological changes in the pregnancy. Although they sound very simple, but they are very important if you are going for obs and gynae. Any person, either it can be nurses or it can be doctors, consultants, whatever, who is working in the obstetric unit must know these changes, because all of their intervention is going to be affected by these changes. So it's very important to understand first of all. So let's start with the CVS. This video will be very short, don't worry, okay? So we'll start with the cardiovascular system. So cardiovascular system, first we go with the plasma volume. So plasma volume is increased by staggering 50%. It's real change, okay? So for example, plasma volume is like 2.5, goes directly up to 3.75. So it's massive change. Heart rate goes up by 15 to 20 beats per minute, not the person, okay? 15 to 20 beats per minute. So on average, let's say person's heartbeat is 70, it goes up to 85 in pregnancy. Now the cardiac output, again a massive change of 40%. So cardiac output means how much blood the heart pumps, it outputs, okay? So it increases by 40%. Well, it's very important to know that if the inferior vena cava compression happens due to the gravid uterus, it decreases the venous returns. That's why, and therefore at the end of the day, cardiac output will fall. When it falls, when the IVC compression happens. But otherwise, in general, it increases by 40%, with a massive change. Now, the uterine blood flow, the uterine arteries. When the lady is not pregnant, the uterine artery are not very prominent arteries of the body. But all of a sudden, when they go for pregnancy, the uterine blood flow is a whole 10% of the whole cardiac output, which is very important. And the uterine artery go into massive change. It becomes tortuous, it becomes larger and very active. So the significance of these changes is when the uterine blood flow, let's say it's 10% of the total cardiac output. If the hemorrhage happens, it happens very rapidly compared to the other organs. You see my point? For example, let's say if the lady is bleeding from a scar, let's say from the skin, the blood loss will not be that much. But if she is bleeding from the uterine blood vasculature, then she will be losing a lots and lots of amount of blood in short time. So that's why it's very important to very aware of the PPH, because when the PPH happens, you don't know, in some time the lady can lose a lot of blood. Systemic vascular resistance, it decreases. So all over vascular resistance, all we'll say generalized vascular resistance decreases, and that's why there is a decrease in the blood pressure here. Look, the blood pressure is also decreased by 10 to 15 mmHg. Venous return decreases due to the compression of the IVC by the gravid uterus. So these all are the cardiovascular changes. These are very important when the bleeding happens. They are very important when the cardiovascular event happens. Now let's go with the respiratory system. Again, very important changes are there. The respiratory rate, it increases from the baseline. Oxygen consumption is increased by 20%. Can you see that? So if a lady stops breathing, then the hypoxia will be very prominent and quicker than the normal person. So because the oxygen consumption is increased by 20%. The residual lung capacity decreases by 25%. That means that the lungs which got some residual capacity, for example, normally lungs work with a certain amount of capacity, but lungs also got a reserve capacity in the event of or when there is a need for more oxygen. But in the pregnancy, the residual capacity decreases by 20%. So if the lady is not able to breathe, it can cause severe hypoxia in no time. Okay, now arterial PCO2 is decreased. Why? Because of the increased in the respiratory rate. So the minute ventilation is increased, that's why the carbon dioxide, more and more carbon dioxide are washed out, and that's why the PCO2 decreases. Obviously, the pregnancy especially in the third latest trimester, laryngeal edema is there. So why we are describing these factors? Because when some unfortunate event happens, for example maternal collapse, at that time it's very important to make this respiratory system work, and we know that it is already compromised, so we have to do more efforts. Now, some generalized measures. The weight increases, everybody knows. Uterus is enlarged, obviously everybody knows. Why I'm mentioning here? Because all of this thing leads to difficult intubation, and the IVC compression, because of the enlarged uterus, it decreases the venous return. So all these things are very important when some sudden event happens. And when I say event, that means collapse. And it's very, very difficult for the anesthetic or the intensivist or for the obstetrician and other clinicians to maintain or to treat this kind of events or episodes. Gastric return decrease. Gastric motility is decreased with the effect of progesterone. Esophageal sphincter is also relaxed because of the progesterone. So this also causes increased risk of aspiration while intubation, and also called Mendelssohn syndrome. So we have discussed in this previous video. So these are the important changes you need to remember. There are lots of changes anyway, but these are the very important, because at the time of any kind of sudden event, it's very important to know these things, and we have to act very, very fast compared to the routine adult population. Thank you very much for looking this video. Thank you very much.